I want to tell you about a conversation I had at 6:47 in the evening 3 months ago. A 72-year-old man sat across from me in my clinic, retired secondary school principal. Organized, disciplined, the kind of patient who arrives early and leaves with everything written down. He had been managing his blood pressure for 4 years, 2 medications. Consistent, compliant, never missed a dose. He pulled out his home monitoring notebook, small, blue, filled with neat columns of numbers. His morning readings had been averaging 138/86 for the past 3 months. Acceptable, manageable. His cardiologist was satisfied. Then he showed me something else, a separate column. Evening readings, taken at 10 p.m. before bed. Consistently higher than the morning numbers, 152, 156, 148, 161. He said, "Dr. Tom, nobody told me to track the evening readings. I started doing it myself because something felt different at night. I do not know if this is normal or if it matters." It matters enormously. And what he said next changed the direction of that entire conversation. He said, "I have been drinking warm water before bed for years. Is there something better I could be drinking instead?" Most people managing high blood pressure believe that what they drink before bed is largely irrelevant to their cardiovascular numbers. The medication is taken, the salt has been watched, the evening meal was reasonable. The day's cardiovascular work is done. Whatever goes into a glass before turning off the light is a comfort ritual, not a clinical decision. I understand completely why people think this. Nobody has told them otherwise. The standard blood pressure management conversation covers medication timing, sodium restriction, exercise, and weight. It almost never addresses what happens to the cardiovascular system in the specific biological window between the last drink of the evening and the first heartbeat of morning. But here is what the published research on nocturnal blood pressure and the specific compounds in specific beverages that interact with nighttime vascular biology consistently shows. What you drink in the 2 hours before sleep may influence your blood pressure during the most cardiovascularly vulnerable hours of the night. Not marginally, meaningfully, through biological mechanisms that are specific, measurable, and directly relevant to the readings that determine your cardiovascular risk over years. The man with the blue notebook had been asking exactly the right question. He had simply never been given the answer. My name is Dr. Johnson Tom. I am a cardiothoracic surgeon with over 2 decades of experience operating on the heart, the lungs, and the chest. I have spent those years not only repairing the damage that sustained hypertension builds inside the cardiovascular system, but studying the upstream biological conditions that send patients to my operating table in the first place. The hours between 10 p.m. and 6 a.m. are one of those upstream conditions, and what enters the body in the window before sleep is one of the most consistently underutilized opportunities in blood pressure management for adults over 60. Your blood pressure does not behave the same way at midnight as it does at noon. In a healthy cardiovascular system, nocturnal blood pressure dips by 10 to 20% during sleep, a biological recovery window that represents the most significant cardiovascular repair opportunity in any 24-hour period. When that dip does not occur, when nighttime pressure stays elevated or surges during the early morning hours, the arterial walls, the kidneys, and the cardiac muscle absorb a sustained load through the hours when the body has the least capacity to compensate. What you drink before bed can either support that nocturnal dip by providing specific compounds that interact favorably with the vascular, autonomic, and renal mechanisms governing nighttime pressure, or it can work against it. The 5 beverages I am going to walk you through today each address a different biological pathway. Each is grounded in published research, each can be prepared at home tonight, and together they represent a pre-sleep cardiovascular support framework that most patients managing high blood pressure have never been offered. By the end of this video, you will understand the specific biological mechanisms governing blood pressure during sleep and 5 specific pre-bed drinks linked in published cardiovascular research to meaningful nocturnal blood pressure support. What each one does at the biological level, how to prepare it correctly, and which one the research most consistently identifies as the most powerful for adults over 60, starting tonight. Before we examine the 5 beverages, I need you to understand the specific biological environment your cardiovascular system is operating in during the hours between sleep onset and dawn. Because this context is what makes everything I am about to describe not just believable, but biologically inevitable. Here is how I explain this to patients in my clinic. Think of your cardiovascular system over a 24-hour period as a large industrial facility running 2 distinct operational phases. The day shift, when the facility is running at full capacity, all systems engaged, full staff present, backup mechanisms available. And the night shift, when the facility scales back to essential operations, the staff is reduced, the backup systems are offline, and the work being done is maintenance and repair rather than full production. The night shift of your cardiovascular system has one primary objective above all others, the nocturnal blood pressure dip. That 10 to 20% reduction in pressure that allows the arterial walls to rest from the sustained mechanical load of daytime circulation, that gives the kidneys a recovery window from the filtration demands of full pressure operation, and that allows the cardiac muscle to operate at a reduced workload while simultaneously undergoing cellular repair. 3 specific biological systems govern whether that nocturnal dip occurs efficiently or whether it fails to materialize, leaving the facility running at daytime pressure levels through the night shift when it has neither the staff nor the reserves to manage that load safely. The first is the renin-angiotensin-aldosterone system, the hormonal cascade that governs how much sodium and fluid the kidneys retain or excrete during sleep, directly determining blood volume and therefore pressure through the night. The second is the autonomic nervous system balance, specifically the shift from sympathetic activation that dominates waking hours toward the parasympathetic dominance that should characterize genuine sleep, a shift that determines arterial smooth muscle tone and heart rate throughout the night. The third is the nitric oxide availability in the endothelial lining of the arterial walls, the vasodilatory molecule that signals arterial smooth muscle to relax, widening the vessel and reducing the resistance against which the sleeping heart must push. The 5 beverages I am about to describe each interact with one or more of these 3 systems specifically. Understanding which system each beverage targets is what transforms a list of drinks into a coherent biological strategy. The first beverage is one that has been used in traditional medicine across West Africa, Latin America, and the Middle East for centuries, and that modern cardiovascular research has now caught up with in ways that make its mechanism not just plausible but precisely understood. Hibiscus tea. And before I explain the biology, I want to tell you about someone like Catherine, 68 years old, retired pharmacist. She arrived at her review having read about hibiscus tea online and wanting to know whether it was safe to try alongside her ACE inhibitor medication. She was asking exactly the right question and asking it to exactly the right person. What most sources presenting hibiscus as a blood pressure remedy do not explain, and what Catherine deserved to know before she started drinking it, is the specific mechanism through which it works. Because understanding the mechanism is what makes the medication interaction question so important. Here is the biology. Think of the renin-angiotensin-aldosterone system, the hormonal cascade governing sodium retention and blood pressure, as a lock and key system. A specific enzyme called angiotensin-converting enzyme, ACE, acts as a key that opens a lock, producing a powerful vasoconstrictor called angiotensin II. When that key turns, angiotensin II is produced, blood vessels constrict, sodium is retained, and blood pressure rises. One of the most commonly prescribed classes of antihypertensive medication, ACE inhibitors, works by blocking that key from turning. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acid, that interact with this same lock and key system. They inhibit ACE activity through a natural biochemical pathway, reducing angiotensin II production and its downstream vasoconstriction effects. This is not a vague wellness mechanism. This is a specific, named, pharmacologically characterized interaction that operates through the same biological pathway as prescription medication. A randomized controlled trial published in the Journal of Nutrition found that daily hibiscus tea consumption was associated with an average reduction in systolic blood pressure of 7.2 millimeters of mercury in adults with mildly to moderately elevated pressure, with effects appearing within 2 to 6 weeks of consistent daily intake. 7.2 millimeters of mercury from a beverage, operating through a mechanism identical in its pathway to one of the most widely prescribed antihypertensive drug classes in the world. The critical clinical note that Catherine's online research had not provided: patients already taking ACE inhibitor medication, lisinopril, ramipril, enalapril, and perindopril, should discuss adding regular hibiscus tea with their prescribing physician before beginning. Combining a pharmaceutical ACE inhibitor with a natural ACE inhibitor through diet may produce additive pressure-lowering effects that push levels below the target range. That is not the goal. The goal is optimization, not overcorrection. For patients not on ACE inhibitor medication, or those whose physician has reviewed and approved the combination, hibiscus tea, consumed before bed, addresses the renin-angiotensin-aldosterone system directly, providing a pharmacologically active vascular effect during precisely the hours when nocturnal pressure management matters most. The preparation protocol: 1 to 2 teaspoons of dried hibiscus flowers or 1 hibiscus tea bag steeped in 250 milliliters of hot water for 5 minutes. Consumed warm approximately 60 minutes before sleep. No sugar or minimal honey if sweetness is needed. Sugar at this hour works against every cardiovascular mechanism this beverage is supporting. Consumed consistently for a minimum of 4 to 6 weeks before evaluating its effect on your evening blood pressure readings. The fix: if you are not on ACE inhibitor medication, begin hibiscus tea tonight. If you are on ACE inhibitor medication, bring this video to your next appointment and ask your physician specifically about incorporating it into your pre-sleep routine. That 2-minute conversation may open a dietary option that has been available to you for years. The second beverage targets a different biological system entirely and addresses a mechanism that medication almost never reaches: the endothelial production of nitric oxide that governs arterial smooth muscle relaxation throughout the night. Consider someone like Thomas, 71 years old, retired engineer. His blood pressure was managed during the day, averaging 132/80 on medication. His evening readings, which he had begun tracking after watching one of my earlier videos, were consistently running 145 to 150 systolic before bed. His cardiologist had noted this, but attributed it to end-of-day physiological variation and had not made a specific intervention recommendation. What nobody had discussed with Thomas was the nitric oxide deficit that develops as the day progresses in adults over 60, and how that deficit specifically contributes to the elevated evening readings he was documenting. Here is the mechanism. Think of your arterial walls as having an inner lining, the endothelium, that functions as a production facility for nitric oxide throughout the day. In the morning, when the endothelium is fresh from its overnight recovery, this production facility operates efficiently. Nitric oxide is produced, released into the arterial smooth muscle, the muscle relaxes, the vessel diameter widens, and resistance falls. Blood pressure reflects that vasodilation. As the day progresses, the endothelium accumulates oxidative stress, the biological equivalent of a factory floor that has been running for 12 hours and has accumulated wear. Nitric oxide production efficiency declines. The arterial smooth muscle receives fewer relaxation signals. The vessels maintain a higher resting tone, and the blood pressure readings of the evening reflect that declining endothelial output. Dietary nitrates, found in their highest concentration in beetroot, enter the body and are converted through the oral salivary gastric pathway to nitric oxide through a mechanism that bypasses the fatigued endothelium entirely. They provide a direct substrate for nitric oxide production that does not depend on endothelial function. The arterial smooth muscle receives the relaxation signal regardless of how the endothelium is performing. A study published in Hypertension, the Journal of the American Heart Association, found that dietary nitrate consumption produced peak blood pressure lowering effects approximately 2 to 3 hours after consumption. In adults consuming beetroot juice in the early evening, this peak effect aligns precisely with the nocturnal hours during which the blood pressure dip should be occurring and during which pressure is most cardiovascularly consequential. Thomas began consuming 150 milliliters of unsweetened beetroot juice at 8:30 p.m. each evening. His evening readings over the following 6 weeks moved from an average of 147 to an average of 138. His overnight monitoring, when we fitted an ambulatory device, showed a measurable improvement in his nocturnal dipping pattern. The preparation protocol. 150 milliliters of cold-pressed, unsweetened beetroot juice, consumed 60 to 90 minutes before bed to align the peak nitric oxide effect with the early sleep hours. Alternatively, beetroot can be juiced fresh at home using 2 medium beetroots blended with a small amount of water and strained. No added sugar, no preservatives. The nitrate compounds are the active element, and they are present in adequate quantities in fresh or cold-pressed preparation. One important note: beetroot juice may cause temporary reddish discoloration of urine and stools, a harmless phenomenon called betaria that surprises patients who are not expecting it. It is not a cause for concern. It is simply the body processing the pigment compounds alongside the nitrates. The fix. Replace whatever you are currently drinking in the 90 minutes before bed with unsweetened beetroot juice 3 to 4 evenings per week. Track your evening blood pressure readings before and after 4 weeks of consistent practice. Let the numbers tell you what the biology is doing. The third beverage is the one that consistently produces the most visible reaction from patients when I describe it in clinic, because it is the one that sounds least like medicine and most like something worth looking forward to. Warm cacao, made correctly, consumed before bed. And the biology behind why it works is one of the most elegant mechanisms on this entire list. Think of someone like Eleanor, 65 years old, retired accountant. She arrived at her review with a specific complaint. She found the pre-bed blood pressure management routine she had been trying to build, the tea, the timing, the discipline, joyless and difficult to sustain. She was looking for something she would actually want to do each evening, rather than forcing herself to do. She needed a habit she could look forward to, not another item on a compliance checklist. Here is the biology of why warm cacao earned its place on this list. Think of the smooth muscle cells wrapped around the walls of your arteries as a team of workers maintaining a rope under tension. Their contraction, controlled by calcium entering the cell through specific ion channels, determining how narrow the artery is and how much resistance the heart must push against. Magnesium sits at the entrance of those ion channels as a natural moderator. When magnesium levels are adequate, it regulates calcium entry. The smooth muscle maintains an appropriately relaxed tone and the artery stays open. When magnesium is chronically low, as research suggests is the case in a significant proportion of adults over 60, the moderator is absent. More calcium enters. The smooth muscle holds a higher resting tension and the blood pressure reading reflects that excess constriction. High-quality cacao powder, specifically raw or minimally processed cacao, not heavily sweetened commercial cocoa, is one of the most magnesium-dense foods available. A 20-gram serving of raw cacao powder contains approximately 55 milligrams of magnesium. It also contains flavonoids, specifically epicatechin, that have been shown in published research to stimulate endothelial nitric oxide synthase, the enzyme responsible for nitric oxide production in the arterial wall. A meta-analysis published in the British Medical Journal examining data from 20 randomized controlled trials found that flavonoid-rich cacao consumption was associated with significant reductions in both systolic and diastolic blood pressure, with average reductions of approximately 2.8 millimeters of mercury systolic and 2.2 millimeters of mercury diastolic across the pooled data. The preparation protocol. 1 heaped teaspoon, approximately 8 to 10 grams, of raw cacao powder dissolved in 250 milliliters of warm, unsweetened plant-based milk or warm water. No sugar. A small amount of honey is acceptable if sweetness is needed. Consumed 30 to 45 minutes before sleep. The distinction between raw cacao and commercial cocoa is critical and is the most common preparation error I see. Commercial hot chocolate products, including most branded cocoa mixes, are heavily processed, often contain added sugars, milk solids and flavoring that diminish the flavonoid and magnesium content while adding compounds that work against the vascular benefit. Raw cacao powder, available in health food stores and online, retains the full flavonoid profile that the research has studied. Eleanor began her warm cacao routine within the week. She told me at her 3-month review, "It is the first health habit I have ever genuinely looked forward to every evening." Her evening systolic readings had averaged 4 points lower than in the preceding 3 months. A modest movement, but consistent, and sustained by a habit she had no difficulty maintaining. The fix. Replace your current pre-bed drink with warm raw cacao prepared as described above on the evenings you are not drinking hibiscus tea or beetroot juice. Rotate these 3 beverages across the week so that each biological mechanism is being addressed on multiple evenings. The rotation is more sustainable than any single beverage consumed every night without variation. I want to stop here for a moment before we continue to drinks 4 and 5. If you are over 60, managing your blood pressure with medication, doing what your appointments have asked, and you have never once been told that what you drink in the 2 hours before sleep may meaningfully influence what your cardiovascular system does during the night, that is not your oversight. This conversation is almost never had in a standard blood pressure management consultation. The appointment covers medication, salt, exercise, weight, the pre-sleep nutritional window, and the specific biological compounds that interact with nocturnal vascular physiology is simply not part of the standard framework most patients receive. You are not behind. You have not been negligent. You have simply been working with an incomplete toolkit. The two beverages I am about to add to that toolkit address the two remaining biological mechanisms I described at the beginning of this video, and between them, they complete a pre-sleep cardiovascular support framework that addresses all three nocturnal systems simultaneously. Before drinks 4 and 5, I want to ask you one direct question. What do you currently drink in the hour before bed? Water, tea, coffee, milk, juice, or something else entirely? Go to the comments right now and tell me. One word or a short phrase. Just that. I read every comment on this channel, and the answer to that question tells me a great deal about the cardiovascular opportunity that is sitting unused in the evening routine of almost every patient I see. The fourth beverage targets the autonomic nervous system, the third of the three biological systems governing nocturnal blood pressure, and works through a mechanism that is less about direct vascular action and more about the neurological conditions that allow the vascular system to perform its own recovery. Consider someone like Robert, 69 years old, retired bank manager. His blood pressure pattern told a specific story. Daytime readings were well managed. His ambulatory monitor showed adequate nocturnal dipping from midnight onward, but his pre-sleep readings, taken between 10 p.m. and midnight, were consistently elevated, and his sleep onset was delayed. He typically lay awake for 45 minutes to an hour before falling asleep, during which his mind continued processing the day's concerns. The issue was not his medication. It was not his sodium intake. It was the autonomic state his nervous system was carrying into the pre-sleep window, and carrying, because of the delayed sleep onset, well into the early night hours during which his nocturnal dip should have been beginning. Here is the mechanism. Think of your autonomic nervous system as a regulatory thermostat with two settings, the sympathetic setting, the alert, activated, threat-responsive mode that dominates waking hours, and the parasympathetic setting, the rest, recovery, and repair mode that should dominate sleep. Blood pressure is governed differently in each setting. In sympathetic mode, the heart rate is elevated, the arteries are maintained in a slightly constricted state, and the kidneys retain more sodium. In parasympathetic mode, heart rate slows, arteries relax, and the kidneys' sodium excretion efficiency improves. The transition between these two settings does not happen the moment you close your eyes. It is a gradual neurological shift that requires the sympathetic system to genuinely downregulate before the parasympathetic system can fully engage. In adults over 60 whose sympathetic baseline is chronically elevated through stress, through habitual cognitive activation in the evening, through caffeine, through the ambient stimulation of screens, that transition is delayed. The heart rate stays elevated, the arteries stay constricted, and the nocturnal dip is delayed or blunted. Chamomile contains apigenin, a flavonoid that binds to GABA receptors in the central nervous system with an affinity that has been characterized in peer-reviewed pharmacological research. GABA-A receptors are the primary inhibitory receptor system in the brain, the biological brake on sympathetic nervous system activation. When apigenin binds to these receptors, it promotes the neurological downregulation of sympathetic activity that is the prerequisite for the parasympathetic shift that healthy sleep onset requires. Lavender, when used as a food-grade additive in tea rather than as an aromatherapy product, contains linalool and linalool acetate, compounds that have demonstrated anxiolytic and sympatholytic effects in published pharmacological research, further supporting the autonomic transition toward parasympathetic dominance. A randomized controlled trial published in the Journal of Advanced Nursing found that chamomile tea consumption was associated with significantly improved sleep quality and reduced nighttime awakening in older adults, with downstream effects on morning cortisol levels and morning blood pressure readings that persisted across the study period. Robert began a chamomile and lavender tea ritual at 9:30 p.m. each evening. Deliberately away from screens, in a quiet room, consumed slowly over 20 minutes. His sleep onset time shortened from an average of 50 minutes to an average of 18 minutes over 4 weeks. His pre-sleep systolic readings moved from an average of 154 to an average of 141 during that period. The autonomic system had been the missing mechanism. The tea had been the specific tool that addressed it. The preparation protocol: 1 chamomile tea bag and 1/4 teaspoon of food-grade dried lavender flowers, or a combined chamomile-lavender blend, steeped in 250 milliliters of hot water for 7 minutes. Consumed slowly, in a quiet environment, at least 60 minutes before sleep. No screens during consumption. The neurological benefit of the epigenin requires the autonomic environment to receive it. A screen-activated sympathetic system with epigenin arriving will produce a diminished effect compared to the same compound arriving in a genuinely quieting pre-sleep environment. The fix: begin the chamomile and lavender ritual at a fixed time each evening, the same time, in the same quiet space, and treat the ritual itself as a cardiovascular intervention rather than simply a comfort habit. The consistency of the timing trains the autonomic system to begin its sympathetic downregulation in anticipation of the ritual before the first sip is taken. The Pavlovian conditioning of the pre-sleep routine is part of the mechanism. The 5th beverage is the simplest on this list, the least dramatic, the one most likely to be underestimated by a viewer expecting something more complex or exotic, and the one that addresses a mechanism so fundamental to nocturnal blood pressure behavior that its absence from the standard pre-bed advice given to hypertensive patients continues to surprise me. Think of someone like Margaret, 73 years old, retired civil servant. She had been deliberately limiting her fluid intake in the evening for 3 years. The reason was entirely logical. She was trying to avoid waking at 2 a.m. to use the bathroom, which disrupted her sleep and increased her fall risk on the way to the bathroom in the dark. Her evening readings had been consistently elevated for 2 years. Her physician had attributed it to white coat effect and end-of-day physiological variation. Neither attribution was incorrect, but neither was complete. Margaret was going to bed mildly dehydrated, every night, by design, and the cardiovascular consequences of that nightly dehydration had never been explained to her. Here is the biology. Think of your blood as having an ideal viscosity, a flow quality that allows it to move efficiently through the arterial and venous network without excessive resistance or excessive clotting tendency. When hydration is adequate, blood maintains this ideal viscosity. When hydration is reduced, even mildly, in the range of 1 to 2% body weight, the blood becomes measurably more viscous, thicker, less fluid. It moves through the same vessel diameter with greater resistance, and the heart must generate greater pressure to maintain adequate flow through a system that has become more resistant. This pressure increase from mild dehydration is not enormous, but it is consistent, and it is occurring during the hours when the cardiovascular system has the least reserve to manage additional demands, the night shift, operating on reduced staff without the backup mechanisms available during the day. The addition of lemon to warm water addresses a second mechanism alongside hydration. Lemon contains citrate compounds that have demonstrated mild inhibitory effects on the angiotensin-converting enzyme in published pharmacological studies, a mechanism parallel to hibiscus acid, working through the same renin-angiotensin system pathway to reduce vasoconstriction. And the addition of a potassium source, specifically a small amount of cream of tartar, which is potassium bitartrate, or a potassium-rich fruit component, addresses the third mechanism, the renal sodium excretion efficiency that is directly dependent on the sodium-potassium balance at the kidney's tubular exchange system. Research published in the American Journal of Physiology found that adequate potassium availability during the nocturnal period supports the kidney's sodium excretion efficiency specifically during sleep, contributing to the blood volume reduction that is part of the healthy nocturnal blood pressure dip. The preparation protocol. 250 milliliters of warm water, not hot enough to destroy the citrate compounds, approximately 60 degrees Celsius, with the juice of half a fresh lemon and a quarter teaspoon of cream of tartar. Consumed 30 to 45 minutes before bed. Not a large volume. The goal is adequate hydration without producing a bathroom urgency that disrupts sleep. This specific volume has been chosen deliberately. It addresses the dehydration mechanism without creating the nocturnal awakening that Margaret had been trying to avoid. Margaret began this preparation each evening at 9:45 p.m. Within 4 weeks, her evening readings had moved from an average of 153 to an average of 143. She did not wake more frequently during the night. The volume was insufficient to significantly increase nocturnal urinary urgency. And her morning readings, which she had always tracked, showed a consistent improvement over the same period. The fix. If you are currently avoiding pre-bed fluids to prevent nocturnal bathroom trips, this specific preparation, 250 milliliters, not more, addresses the hydration and renal mechanisms without producing the disruption you have been trying to avoid. Begin tonight. The preparation takes 90 seconds. The biological effect operates through the entire night. Here is how all 5 beverages work together as a weekly pre-sleep framework. Not 5 drinks every night, that is neither practical nor necessary. A structured rotation that ensures each biological mechanism is addressed multiple times per week. Monday and Thursday evenings. Hibiscus tea. Addresses the renin-angiotensin-aldosterone system directly. Consumed at 9 p.m., 60 minutes before sleep. For patients not on ACE inhibitor medication or with physician approval. Tuesday and Friday evenings. Warm beetroot juice. Addresses the nocturnal nitric oxide deficit. Consumed at 8:30 p.m., 90 minutes before sleep to align the peak nitric oxide effect with early sleep hours. Wednesday and Saturday evenings. Warm raw cacao. Addresses the magnesium-calcium balance in vascular smooth muscle and provides endothelial flavonoid support. Consumed at 9:15 p.m., 45 minutes before sleep. Every evening. Chamomile and lavender tea. Addresses the autonomic nervous system transition from sympathetic to parasympathetic dominance. The neurological prerequisite for all other nocturnal cardiovascular mechanisms to function effectively. Consumed at 9:30 p.m. in a quiet, screen-free environment. Every evening. Warm lemon and potassium water. Addresses hydration, mild ACE inhibition through citrate, and renal sodium excretion efficiency. Consumed at 9:45 p.m., 30 to 45 minutes before sleep. The chamomile and lemon water can be combined with any of the other 3 beverages on their respective evenings, consumed together as a pre-sleep ritual. The rotation ensures variety, sustainability, and comprehensive biological coverage across the week. The tracking rule. Measure your blood pressure at 10 p.m. after the beverage, before sleep, 3 times per week. Record both numbers. After 6 weeks of consistent practice, compare the average of those readings to your baseline from the 6 weeks prior. That comparison is the honest measure of what the protocol is doing for your specific cardiovascular biology. Bring those numbers to your next physician appointment. I want to tell you something that has stayed with me since the first year of my surgical training. My consultant, a vascular surgeon with 30 years of operating room experience, said something to me during a late-night procedure that I have carried into every patient conversation since. He said, "Johnson, the patients who end up on this table are not here because medicine failed them. They are here because nobody ever connected the small daily decisions to the large outcomes, the evening meal, the morning walk, what they drank before bed. The gap between what we know in the research and what we communicate in the consultation is where most of the damage happens. I have stood at the operating table many times since that night. I have seen the damage that sustained nocturnal hypertension builds in arterial walls over years. The thickening, the stiffening, the reduced diameter of vessels that should have maintained their flexibility. I have seen the cardiac muscle that has remodeled under years of pressure load that should have had a nightly recovery window but did not. And I have asked myself with consistency the same question my consultant implicitly posed all those years ago. What information did this patient not have? What small daily decision, if understood correctly, might have produced a different vascular landscape in front of me tonight? The pre-sleep beverage is one of those decisions. Not the only one, not a replacement for medication or clinical management, but a daily, consistent, biologically active intervention that operates through the specific hours when the cardiovascular system is most vulnerable and least able to compensate for the conditions it is given. The man with the blue notebook had been asking the right question for years. He had simply never been given the answer. You now have it. 5 beverages. 5 biological mechanisms. A complete pre-sleep cardiovascular support framework. 1. Hibiscus tea, addressing the renin-angiotensin-aldosterone system through natural ACE inhibition, linked to 7.2 millimeters of mercury systolic reduction in the Journal of Nutrition randomized controlled trial. 2. Warm beetroot juice, delivering dietary nitrates that convert to nocturnal nitric oxide through the oral salivary gastric pathway, with peak blood pressure lowering effect aligning with the early sleep hours when nocturnal dipping should begin. 3. Warm raw cacao, delivering magnesium to moderate calcium entry into arterial smooth muscle cells and flavonoids that stimulate endothelial nitric oxide synthase, associated with significant pressure reductions in the British Medical Journal meta-analysis of 20 randomized controlled trials. 4. Chamomile and lavender tea, supporting the autonomic transition from sympathetic to parasympathetic dominance through apigenin binding at GABA-A receptors, addressing the neurological prerequisite for all other nocturnal cardiovascular mechanisms to function. 5. Warm lemon and potassium water, addressing mild nocturnal dehydration, providing citrate-based mild ACE inhibition, and supporting renal sodium excretion efficiency through the potassium-sodium exchange mechanism at the kidney's tubular level. A rotation across the week. Every evening, including chamomile and lemon water as the foundational 2. The remaining 3 rotating Monday and Thursday, Tuesday and Friday, Wednesday and Saturday. Tracked with evening blood pressure readings 3 times per week. Reviewed against baseline after 6 weeks. Brought to your physician appointment as data. The 2 hours before you turn off the light are not a neutral window in your cardiovascular day. They are the preparation phase for the most important cardiovascular recovery period in your 24-hour biology, the nocturnal dip that your arterial walls, your kidneys, and your cardiac muscle depend on to maintain their integrity across the years and decades. What you put into your body during those 2 hours either prepares that recovery window or fails to support it. You now have 5 specific, biologically grounded, research-supported options for making that window count. The preparation takes 5 minutes. The biological effect operates through the entire night. Tonight is where it starts. Go to the comments right now and tell me, which of the 5 beverages are you going to try first tonight? Hibiscus tea, beetroot juice, warm cacao, chamomile and lavender, or the lemon and potassium water? One answer, just the name of the drink. I read every comment on this channel, every single one. And if this video gave you something real, a framework you are going to bring to your evening routine tonight, please share it. There is someone in your life managing high blood pressure who has been drinking the wrong thing before bed for years without knowing a better option existed. Send this to them tonight, before they make their evening cup. And if you have not subscribed yet, please do. Every week, I bring you the cardiovascular conversation that the 15-minute appointment never has time for, grounded in published research and delivered with the clinical honesty that your health decisions deserve. One final thing, and I mean this as genuine clinical guidance. Everything shared in this video is general health education based on published cardiovascular, pharmacological, and nutritional research and over 2 decades of clinical experience. It does not constitute personal medical advice. The beverage recommendations in this video are intended to complement, not replace, any medication or treatment plan prescribed by your physician. Patients on ACE inhibitor medication must discuss hibiscus tea specifically with their prescribing physician before adding it to their routine. Patients with kidney disease should discuss potassium intake with their physician before increasing it through dietary means. Any significant dietary change should be reviewed with your healthcare team in the context of your individual medication list and health history. Bring this video to your next appointment. Have the conversation. Your physician is your partner in building the most complete blood pressure management framework available to your specific biology. Take care of your heart. It works for you through every hour of every night. Give it the conditions it needs to recover. I will see you in the next video.